Hi, today we're going to talk to you a little bit about how we do chin liposuction. So we have a lovely patient here today who is wanting to get the chin liposuction, and she's a good candidate for this because if you can see here, she has extra fatty tissue underneath the chin and the skin is a little bit loose. And so some people will say, oh, you know, they have something like this and they tried Kybella. And I don't think Kybella works that well for stuff like this because it doesn't help with the looseness of the skin and it doesn't get rid of all the fat. And it doesn't work as thoroughly as doing liposuction does. Liposuction is immediate, you see the results right away, and it also helps get some skin contraction and helps with the contour, and you can also do it in a much more effective, sculpted way. So when I do the liposuction, I make a tiny incision underneath the chin here, and then we suck out the fat here, and I sculpt the tissue to recreate the jawline, recreate the shape here, and that you can't do with Kybella. And so now we're going to go over a little bit of the procedure and we'll see a little bit more in a couple minutes. Okay, now swallow. Okay. Did that hurt? Good. Yeah, solution and the numbing medication. You can see it's all swollen up. She's totally numb here, and she's totally awake. Can you feel anything down here? Okay, so we're going to make just a tiny little incision right here, where we're going to put the cannula through. And what we're going to do is we put the cannula through there, and now the cannula goes, and there we go. I already pre-dissected this area, and you can see, now just start sucking. Does it hurt at all? Good. All right, just take it easy. And I like to do this by hand because in my training I did a lot of head and neck surgery, a lot of reconstructive surgery, and you can feel where the fat is. And if you know how to do it and you know the surgical plane, you know where to put the fat, you know where you put the where to put the cannula, and you can suck the fat out in the right position. Do it little by little, and I go by feel. And so I'm just feeling with my finger, being careful to know where the muscle is and the other stuff. And then I get into the right spot, and I start sucking again. And I do it by hand because I can control the pressure with my hand and the syringe. Whereas when you use a machine, you can't do that, and it just sucks everything, and you don't have any control. This gives me a lot of control, and I can see, I know exactly where I'm going every time, and I can get a really good contour out of it. Now it takes takes longer to do it this way, but I think the result is far superior. And I can contour. I marked this before. This is where she had a little bit of a jowl here. I'm going to contour that too, and I do it very gently without a lot of trauma to give the least amount of injury to the tissues. You having any pain? So you can see here already we've sucked out a lot of the fat. And you can see before when we pinched it, it was thicker, and now it's thinner here. I'm adjusting the suction, the level of the suction with my hand, and it's done by feel. You know, it has to do with how much I'm sucking on this, pulling on the syringe. The more I pull the syringe, the higher the suction. And see, it's a little bit thicker here. See, it's thinner here and thicker there, so I'm going to do a little more here on the side. And the process is, it's dynamic. You have to kind of get a feel. It's a little bit of an art, I think. But that's why I don't like using the suction machine, because you can't do this with the machine. The suction machine will just suck everything. Doesn't feel anything. You can't feel it. So to do this, you really have to understand the anatomy here, where the platysma muscle is, where the submandibular gland is, where the facial artery, the marginal mandibular branch of the facial nerve. It's a lot of stuff in anatomy that you got to know, and really after doing so much reconstructive work and stuff like that, a lot of reconstructive surgery, you kind of learn where all that stuff is. We got everything kind of really thinned out, and I'm just going to put the dressing on. I just close it with a little Steri-Strip. This is all still fluids swelling here. This is going to go down, but all of this, once she keeps the compression, will go down. But you can see it's already less than what it was.